My name is Charlene Margot, co-founder of nonprofit The Parent Venture and founder of the Parent Education Series. We are delighted to have with us tonight Dr. Bonnie Ju, who will be talking to you about why oral health matters. Take it away, Dr. Ju.
Thank you, Charlene. I'm going to share my screen here. Well, good evening, everyone. Thank you so much for your time and attention today. As Charlene mentioned, I've been a dentist for quite a few decades now. And one thing that I love to do is to talk to people about their teeth and help them answer questions that they may have about taking care of them, as well as those of their family members. So one thing that I teach my dental students right from the first day of school is that dental health actually affects your overall health. So that means that if you have existing medical conditions like heart disease, respiratory diseases, having poor oral health can actually make it worse. Or if you don't have them yet, it can actually increase your chances of getting it. So that's something that I want all people to know, because you might think, oh, well, I'll take care of my teeth later. I'll have to save up and I'll spend it on vacation first. But actually, you may be impacting the rest of your health by holding off on dental care. So a lot of people ask me, well, why fix baby teeth though? They just fall out, Dr. Bonnie. My answer is that, well, not only are they very important for kids to eat well, smile, but they're also important placeholders, space holders, if you will, for the adult teeth. Since some of these baby teeth may not change until your child's about 10 years old. That's right. So if they have a cavity on the tooth at age 3, that tooth isn't going to be ready to change until they're about in 5th grade. So it's really important to fix it while they're young. Plus, studies have shown that having a nice smile, not worrying about the way their teeth look, can improve a child's self-esteem and self-confidence, and even their performance in school. That's right. Better oral health may help your child be more successful in their classwork. Did you know that actually, there we go. Caries, or what we call dental cavities, is the most common chronic disease of childhood. I was actually surprised to find out that having dental toothaches is one of the top reasons why kids miss school. Not just a sore throat or stomach ache, but because of toothaches. And poor oral health are more likely to have kids miss school by 4 times than those that don't have toothaches. A child that has had a recent toothache is 4 times more likely actually to have a lower grade point average. So I hope that's some incentive for all you parents there to help remember when the last time you brought your child into the dentist, because it can actually help their GPA. Going back to what I had mentioned about baby teeth being important space holders for the adult teeth, as you can see from this diagram, that the adult teeth actually start to grow inside the bone, inside the jaw, years before you actually see it in your child's mouth. So this is a picture of the baby tooth, of the back molar. And this is an adult premolar. It's your medium-sized bicuspid teeth. Well, those don't start to grow in until you're about 10 years old. And what happens is that years before that, it's developing, it takes a while, and as it's growing through the bone, it pushes up and dissolves the root of the baby tooth. And that's how baby teeth get loose. It's actually because they start to lose their root, and then they get loose and they pop out, and all you see is the crown of the tooth. It's not because they weren't born or didn't develop roots. It's because all those roots have been dissolved away by the adult tooth. And then the adult tooth takes its time to fill in the space. So that means if you lose this baby tooth years early here, and this tooth is not ready to fill in that gap until later on, what happens is all the other teeth start to collapse into that empty space. So that years later, when all those teeth are supposed to be growing in, there's no room. And now you have to consider a lot of expensive orthodontic work just to make space for those teeth to grow in properly. So it's really important to take care of your teeth. And one way to do that is by managing the amount of plaque in your mouth. Plaque is that sticky stuff that forms. We all get it every day. It forms no matter how much we brush, but that's why we brush every day. And there are germs that live inside that plaque that actually love to eat what you eat, and it creates acid, and the acid weakens the teeth and makes holes in them. And that's where we get dental cavities. Almost over half of kids aged 5 to 17 have dental cavities. Now, this is a pretty severe form of it, but believe it or not, I see hundreds of kids like this a year because I go to schools and do free dental screenings. And last year we screened about 3,000 children, and over 15% of them had teeth like this. That's about 450 children with teeth this severe. And decay starts, as I had mentioned, by the germs eating the foods you eat, particularly processed and sweet foods, to produce that acid that sticks on your teeth inside the plaque, creates the holes inside your tooth. So we kind of teach kids that, oh, the sugar bugs eat your teeth, but actually it's the sugar bugs that poop out the acid that eat the hole through your teeth. And one thing that you can do to help your child is to actually look at their teeth early on to see if they might be starting to get cavities. Now, don't feel bad. I had actually mentioned to Charlene earlier today that kids as young as 18 months old can get cavities. So it can happen very easily. And when I was 3, by the time I was 3 years old, I had 13 cavities. That's right. My dad was in dental school. My mom was working as a secretary to support us. And my grandmother raised me, and she loved me so much, she gave me candy every day. Some of the happiest days of my life until I had to see the dentist for multiple appointments. So don't feel bad if your kids have cavities. Instead, be proactive and feel empowered to help try to prevent them. So the first sign of cavities in your child are these white spots. They may look harmless, but they are actually the start of a cavity forming. The enamel is starting to demineralize from that acid, sort of like an etchant, right, on stained glass or on glass, and you have an acid etchant. Then what happens is that the holes start to form. And if that's not taken care of, the holes can actually eat through the first layer of enamel and into the second layer of tooth structure called dentin. And that's where it can spread very quickly and can turn into this in a matter of 6 months to a year, believe it or not. Baby teeth are different than adult teeth in that it takes a long time for adult teeth to get a cavity that's very large because we have thicker enamel on our permanent adult teeth. And so it can take a while for that acid to eat through it. Primary teeth or baby teeth don't have that thick layer. They have enamel, but as you can see, their teeth are much smaller. So that acid eats through that enamel much more quickly and into that second layer. So that's why you should bring the child to see the dentist at least twice a year so that we can catch the cavities when they just start. And at home, what you can do is flip the lip. It's an easy way to check for those white or brown spots on the teeth. And when you do, you can contact your dentist to see if you should be bringing your child in. Another condition that we see in a lot of children, not as many nowadays, but before, is what used to be called baby bottle tooth decay or early childhood caries. There's some fancy terms for conditions that have been around a long time. And that's when the baby is put to sleep with a bottle of milk or juice, anything that's not water, that has sugar in it. Even if it's natural sugar, it can eat through teeth. And the patterns usually show the front teeth being decayed away first and then the back teeth. So it's not unusual to see children where all of their front teeth have decayed away by the age of 3 years old, preschool. So I've seen some children like this, and even though they're young, they're already aware that they look different. And so that's why, it's not only just the physical condition of the, but it's also sort of a mental wellness that you're helping your child with when you're helping them fix their teeth. So I know a lot of doctors and nurses now are talking more, addressing this more because, they might see you before myself as a dentist will see you and your baby. But it's really important to know that once they're done with the bottle or nursing or breastfeeding, to take them off the breast, take out the bottle, and then let them sleep. Don't let them eat or drink anything for 2 hours at least. And that way the teeth aren't soaking in all the sugar or being bathed in that sugar. Even though it's natural sugar, still sugar, unfortunately. So we recommend using sippy cups at an early age. You can start introducing your child to the sippy cup at about 6 months of age and start weaning them from the bottle at about 1 year old, because it's what we've discovered is that, well, I guess any parent will eventually find out is that sometimes it's easier to have a 1 year old do something than a 2 year old. Try convincing your 2 year old to do anything, and you probably understand what I'm saying. So earlier is better in trying to transition out of something. Also, another thing that you and your family members can help your child with is to use your own spoon and chopsticks, cups, utensils. When we share eating utensils, we actually introduce bacteria into the child's mouth that can cause cavities. Believe it or not, babies are not born with the bacteria or germs that cause cavities. They get it from us. We inoculate them with it by sharing utensils or kissing them on the mouth, or just sharing saliva with them. So again, we as parents have enough to worry about. Don't feel bad if you've already done that. It's going to happen eventually anyway. Just think about preschools. It's hard to keep things out of babies and toddlers' mouths. But we can do more to help minimize that introduction of bacteria. Okay, fancy term is vertical transmission. For those of you who want to know some more dental terminology. Okay. Well, what else can we do to prevent dental problems for our families and for ourselves? We all know that eating a healthy diet is really important. Fruits, vegetables, protein, dairy. Less sugar intake for sure, but not just candy or cookies or cake. It's actually sugary drinks that are a big culprit of dental decay. And it doesn't mean to completely cut it out, even though that's what this picture indicates, but to be mindful. I'm all about moderation. And you know what? After this presentation, I might go out and get a milk tea boba drink because that's one of my favorite drinks. But that will be my only boba drink for the week. So, it's about balancing and not totally depriving yourself of that. The other thing you can do too is in many places might let you customize your drink. You might choose a drink that has less sugar than the other one, or at these milk tea places, you can choose what sugar level that you want. So, you can choose 25% or 50%. But again, it's all about moderation and also not depriving your children too, because when they go to school, they're obviously going to be introduced to treats, right? Somebody's birthday or a holiday and a celebration. So we want to be realistic about it, but to also let them know to be mindful of if you have dessert, then you don't want to snack in between your meals that day. Also be careful of what what we think are healthy or natural food products. And I'm not here to target any one type of food, but things like yogurt or drink or juice or chocolate milk. I love chocolate milk. Again, moderation, right? Applesauce, it's very convenient. I like those squeeze pouches. But instead of eating, if you can have a choice between applesauce and eating an actual apple slice, that might be a more nutritious option because of the fiber. So try to pick things that give you more bang for your buck, right? And give you more nutritional value, because you can't avoid sugar. It's in everything that we eat. Okay, so I've been talking a lot about the amount of sugar, and what's actually is just as important is how often we eat sugary snacks and foods. So I'm going to ask you a question. I know I don't see any of you here or can't see your faces, but I want to ask you a question. Do you think that we're more at risk of getting cavities if we eat, let's say I have, these orange slices. If I eat an orange slice one every 10 minutes, or if I eat all 4 of them at one time and then don't eat or drink anything for about an hour. Okay, so think of that. And if you said, I want to eat it all at once and then don't eat anything or drink anything for about an hour or two, you would be correct. And that goes for other like adult drinks as well, like coffee with sugar, those hidden sugars. I see some thumbs up. Oh, that's really cool. Thank you. And yes, that's right. Because what happens is every time we eat something, the acidity in our mouths go up. And when that acid level is high, that's actually the red danger zone for getting cavities. That's when the bacteria can work more efficiently at eating through our teeth. It takes our saliva about half an hour for that acid level. So even if I brush my teeth after eating something, that acid level is still there and it still takes that half an hour for it to go down. So what's better, so every time I'm eating a slice of orange or a piece of chocolate, the sugar acid level goes spikes high, takes a while to go down. So if you're eating something every 10 minutes, you're constantly at that danger zone. So it's better actually to eat everything all at once. That means your meals, you can throw on a dessert on top and the acid level will spike, and then give your mouth a break or a rest or a little nap, I tell the kids, by not eating or drinking anything for a couple of hours. And you'll be more in that neutral buffer zone for longer in the day, and you won't get cavities as often. Okay, so here's another next level pointer here. We've all heard about, oh, make sure you brush and floss after eating. Well, now we kind of tweaked it a little bit. Now we're recommending people to wait about 30 minutes after eating something to brush your teeth. The reason is right after you eat something, all that acid is making your teeth microscopically softer than if it wasn't there. So again, I don't want to make anybody nervous or have high anxiety, but if you waited 30 minutes for that acid level to go down, your teeth now are a little bit firmer so that when you're brushing, you're not brushing your teeth when they're soft, but rather than when they're hard. So, that being said, you could always rinse your mouth out after eating. If that's the only time you get to brush, you can go ahead and brush, because I'd rather people brush than not. Okay, but that's sort of like the advanced level of acid control there. Okay, and something very important to know, tap water is good for you. You want to drink tap water because it has fluoride in it. In most regions, tap water has microscopic levels of fluoride that can help fight tooth decay. So water of any kind is good, even bottled water, but bottled water doesn't have that fluoride in it. So you'll lose that extra help in fighting tooth decay. Okay. And then when you do brush, you want to brush for a full 2 minutes twice a day. That's right. It's if you start counting, if you actually count and keep track, it's going to feel like a long time, but it takes that 2 minutes to get the toothpaste to cover all of your teeth. And the toothpaste has fluoride in it to strengthen that enamel. And doing it twice a day at least helps to, again, introduce your teeth to that fluoride. You can do it in the morning before you go to work, go to school. You can, most importantly, you want to brush before going to bed, because at night our teeth, our mouths dry out. And when we have a dry mouth, the bacteria actually is more effective in giving us tooth decay. So that goes for people of all ages, especially older adults. If any of you have parents or grandparents in your household, when you take medications, the medications dry out your mouth as well. And so it's important to make sure that your teeth are clean before you go to sleep, so that you don't give that bacteria a chance to go into overdrive and give you tooth decay. Now, I've mentioned toothpaste. A lot of the question I get a lot from new parents is toothpaste safe for my toddler or child to use? And the answer is yes, but you just want to use a little bit. So for kids under the age of 3, so that means 0 to 2 years old, you can put a grain of rice size amount on the toothbrush, just like here. And that's usually enough to get the fluoride introduced around the teeth. When the children are 3 years old and older, then you can graduate up to a pea-sized amount. And this amount is usually enough for people of all ages. Okay. We have, um, as we get older, sometimes we like a little bit more toothpaste coverage or feeling, then you can go ahead and put a little bit more, but we don't need those big ribbon sizes of toothpaste on our toothbrushes. If your child ends up, not being able to spit out all the toothpaste, if they're only given that rice-sized amount or even the pea-sized amount, then it's not too much. Hopefully by the age of 3, they're able to spit out most of it. So you want to monitor that when you start introducing toothpaste, because a lot of them taste good nowadays for children. The children's toothpaste is like bubblegum flavored, fruit flavored, which is nice because then it doesn't have that hot, the kids always say it's hot. The mint is hot. So they like the fruity flavors, but you don't want them to eat it because that can actually lead to them having too much fluoride in their systems. And it can lead to if a child swallows too much toothpaste chronically, like this is, on a regular basis, it could end up giving them spots on their teeth called fluorosis, but not very common and very much preventable. So just monitor that. Okay. And I know this picture shows that big ribbon of toothpaste because it always looks so nice in photos. But again, pea-sized amount is all you need. And you want to brush each sextant of your mouth to, about 20 seconds each so that you're covering all the areas over 2 minutes. And then just remember to brush your tongue too, because it harbors a lot of bacteria. It might be a little tricky to try to brush your children's tongue, but again, if you start early, they get used to it. And I know a lot of kids who love brushing their tongues. I think they just like sticking out their tongues too, or having a reason to, but whatever works. And keep in mind that children under the age of 8, sometimes even under the age of 10, need help or benefit from help brushing their teeth, especially their back teeth, because many times they're not able to reach the back teeth effectively or thoroughly enough to get, especially near the tongue, right, on the tongue side. Now you can, a lot of questions I get from parents is, well, my child doesn't like brushing. What can I do? Sometimes you can use 2 toothbrushes, give them one, you use one, you can have them brush and then you follow up, or, you just make a point to say, this is something we have to do, just like eating, certain foods that you might not like, and really try to make it a routine and a priority before going to bed. Maybe soon after dinner so that you're not fighting before bedtime. Doesn't have to be right before bedtime. It could be after dinner, so that they're not eating anything else at night. But again, starting when they're like 1, before, it's not about brushing the teeth so much, or even as a baby, use a wet washcloth and wipe their gums, because then they will be used to the sensation of having somebody, cleaning out their mouths after eating. And hopefully that might help a little bit. But every child is different. So, you can see what works for yours. Okay. And now some just general tips that common questions I get. What type of toothbrush is good? I always recommend a soft bristle toothbrush that with a small toothbrush head. Sorry, I forgot to write that in here, so that it fits in the back of your mouth. Again, for people of all ages, soft toothbrush. Some people like the medium or firm ones, but what happens then is that you have very fragile gum tissue around the teeth. And if you have too firm a toothbrush, you can actually brush away some of the gum tissue that you don't want to. So that's why we recommend a soft toothbrush. The soft toothbrush will also help you when you're angling the toothbrush along the gum line of the teeth, because that's where the plaque or the germs like to hide most easily, is right in the crevices along the gum line. And don't forget this, if your toothbrush looks like this, it's time to change it. But even if it doesn't, please change your toothbrush every 3 to 4 months, because bacteria and germs can actually build up in your toothbrush. For people that are getting a toothbrush like this after a few weeks of using it, it could mean that you're brushing too hard. Yes, you get an A+ for effort, but really it's not doing your teeth, your gums, or your toothbrush any good by brushing too hard, because by this point the toothbrush is ineffective, and also you might be again rubbing away that fragile gum tissue. Okay, so some pointers there. If you think that you might be scrubbing too hard, but you're having a tough time modifying how you brush, because a lot of times, face it, it's like a second nature how we brush. We could brush our teeth like half asleep, right? Which we do most of the time. You could switch to your non-dominant hand. So if you're right-handed and you're brushing your teeth, that's a lot of strength you have there. Try brushing your teeth with your left hand, and I bet you probably won't be as forceful with it just naturally. Or start on the inside near the tongue of your mouth versus the outside. That can also help break up the routine as well. But a very common problem I see among my patients, my adult patients, is gum recession. Right. Okay, so a lot of people ask me, are electric or powered toothbrushes good? And yes, they are very good, but again, don't overdo it, because this is very common too. If you press too hard with the electric toothbrush, it's already doing the work for you. So all you have to do is guide it around from one end to the other. And there are, electric toothbrushes made for children as well. They tend to be a little bit less powerful, have a smaller toothbrush head. And so those are good for kids. You don't have to use it twice a day. You can just use it once a day and then use the manual toothbrush the other time. I like switching it up a little bit, getting kids used to having both, models to use as well. And then be sure to clean in between for yourself and your children. You can either use the conventional floss here, where I recommend taking about 12 to 18 inches of floss out and winding it around, get this, your middle finger, not your pointer finger. We're all used to using our pointer fingers, I think, to do a lot of things, including wrapping the floss around it. But when you do that and you're trying to get that floss to the very back, you'll probably notice it's like trying to get your fists into your mouth. And that doesn't work as well, no matter how small your hands are. But if you anchor the floss around the middle finger of at least one hand, and then use your pointer finger or thumb to navigate it to the back, you'll probably feel that you are able to get your finger back there without having to try to get the whole hand back there. So try that tonight and see if that works. And then, of course, when you're flossing, you want to wrap the floss in a C shape once it goes between the teeth, and slide it gently between the gums and the tooth, because that's where, again, the bacteria is going to hide. And then you slide it up and down the sides of the teeth, not back and forth like a towel that you're drying your back with a towel, but up and down. And then these floss picks are also very handy. They're not as, maneuverable as I'd say regular flosses, but for people who might have trouble with their dexterity, especially children, they love these flossers or these floss picks. Usually the ones where kids don't have the sharp end at the edge of the flosser. But those are nice to at least introduce kids to flossing, or you can use it in your child's mouth too. And then I had mentioned making sure you bring your child to the dentist at least twice a year to catch dental problems early. And it also establishes a really healthy habit for them that will carry over into their adult life, hopefully, in that if you bring them before dental problems start, they'll associate seeing the dentist with happy and fun things, getting a prize, or getting a good checkup, or just counting the teeth and not really needing to get the fillings done. It's when you wait until there's a problem and then you see the dentist or the doctor or anything that one would associate that person with a dental problem, or needing to get my teeth drilled on, something like that. So again, that's another benefit of bringing your children in earlier. Okay, and yes, we actually even recommend babies start to see the dentist by the age of 1, or when their first tooth appears, to get them used to the sight, sounds, and smells of the dental office. right? We all know that. It might even be in our subconscious as adults, right? Adults now. But dental offices, hit a little differently than other places. Right when you walk in the door, sometimes you can tell it's a dental office. So that's what we want to have our kids associate with something positive and not be afraid of it. Some things that you can do to help prepare your child for the dental appointment is a few weeks before, have them, lie on their back and open their mouths and count their teeth. Now, they wouldn't necessarily be lying on the floor in a dental office, but just lying down, being in that prone position, that supine, position where they're lying on their back can feel very vulnerable. So if you're doing that in a safe, comfortable place ahead of time, they can be used to that sensation a little bit before their dental appointment and perhaps maybe feel a little bit more comfortable. And then when you count their teeth, that's what I usually do as a dentist. And when I'm seeing young children is I start off by showing them the little mirror that I have. And I tell them I'm going to use the mirror to look at their back teeth and I'm going to count their teeth. Sometimes I use a little tooth counter too that might make clicking sounds on the teeth. That's like that metal Explorer that I use, the fancy word for the metal pick that we use. But we just use it on the tooth surfaces. For kids, we don't usually need to pick at their gums like we do for adults to check for gum disease. So I'm probably mentioning things that might be reminding you of a little bit of dental anxiety. So that's when I want to actually go ahead and talk to you about during the dental appointment. Try to look calm because kids, as you know, they pick up what we're feeling really well. I mean, they're really good at picking up what we're feeling. If we have anxiety, if we look scared, then they'll start to feel it too. So if sometimes as a dentist, I'll see the child doing really well, but looking at the parent, and I know we as parents, I have 2 kids myself, we can't help it. We're not even doing it on purpose. We're probably not even conscious that we're doing it. But don't be surprised if the dentist or the dental hygienist might gently ask the parent to maybe step out of the room for a few minutes. And believe it or not, that can actually really calm down the child when they don't see the parent there. Even if you're actually not looking anxious, just having the parent in the room can make the child behave in a certain way that would be different than if they were by themselves, like in school. So I actually was at a dental screening in a school for preschooler and kindergartners last week, and one of the mothers was volunteering, and so she actually was there, and the little girl didn't want us to look in her mouth, but the mom said she was looking forward to this so much, and so what happened then is the mom had to leave the room, and the little girl was still there, and she was watching all of her classmates, getting their teeth checked, and almost within a minute or two, she wanted that done, and it's as if her behavior changed dramatically without even prompting her. So kids are really smart, and very adaptable. But don't feel offended though if you find that stepping out of the room helps your child get through that dental appointment. What another thing too is that sometimes there are a lot of people in the dental room talking at the child open wide, or oh, stay still, or don't worry. So it could be a lot of sensory overload for children. And what we recommend is letting the dentist or the dental provider do most of the talking. Sometimes I won't even say anything. I'll have my dental assistant do all the talking so that I can focus on getting what I need to get done. And the child is just focusing on the dental assistant's, nice, calm, soothing voice. So I do the same thing. If you have really young children, you might even have the dentist suggest what we call a knee-to-knee exam. That's when they're, maybe 1 year old, maybe even 2 years old. The chair is really big, and it's a lot of room for them to move around or squirm around. So what we do, and this works really well with babies actually, is that we have the parent or the caregiver and the dentist sit across from each other with the knees touching, and our laps are actually the dental chair. And the child lays down, they're looking up at the parent or the caregiver, somebody they're familiar with. So hopefully they're comforted by that. The parent can help hold down, help hold the child's arms in a comforting manner, and the dentist can look directly down into the child's mouth. And don't worry if they're crying, because you'll see if we're doing anything that's hurting your child, and you'll probably notice that all we're doing is using a mirror or brushing the teeth. And if they're crying, it actually helps me to get the checkup done more quickly because their mouth is wide open. They're having kids though that are able to cry with their mouths closed though. They're very smart. But don't worry too much if your child is crying, and you'll notice probably right when they sit up, they stop crying. And it's their way of communicating to us that they're feeling nervous, and so it's a very natural reaction. All right, dental x-rays are commonly done if a child is already starting to get cavities, and we suspect there might be cavities in between. So it's a very good tool to help us check for cavities that are forming in between the teeth. Okay, and it really depends on your child what age is good to start getting x-rays, and that would be a good question for your dentist. So we usually incorporate risk level. If they don't have any cavities, that doesn't look like they have a lot of plaque buildup, and they don't look at high risk of getting cavities, maybe I'll wait another 6 months to take x-rays. If I suspect that there might be cavities, then I for sure want to make sure I don't miss anything that's in between the teeth that I can't see without an x-ray. Okay, and then a couple more things. We use fluoride varnish at dental appointments sometimes. This is like a stronger gel version of toothpaste that's sticky. It actually sticks on the teeth, and that way the tooth can absorb more fluoride in it to help strengthen the enamel and fight and prevent cavities. Sealants are really good for teeth, especially new adult teeth in the back, the molars. That's because adult molars tend to grow with very thin grooves like this, and they're thin enough to trap plaque, or they're big enough to trap plaque, but thin enough where it's hard for a toothbrush bristle to get all of the bacteria out from those grooves. So what we do is, on a relatively new tooth, we like to clean off the top and fill it with a river of plastic. And that plastic helps to block the germs from getting stuck in those grooves. Now, it won't prevent cavities from starting in between the teeth. So you can still get cavities, but these sealants can last a while, and they do a very good job at preventing cavities that start on the chewing surfaces, which is one of the first spots that get cavities. That's where a lot of mine were when I was 3 years old. And some of those sealants I still have in my mouth, little bits of them there still protecting me. After the dental appointment, make sure to make your next follow-up dental appointment, especially in this day and age where I'm seeing dental offices being very busy. So when you call in for a dental appointment, you may not get one right away. Whereas if you made it before you left your last appointment, you already have something in the books. And it's a good reminder for you too, because I don't know about you, but I'm a dentist, and I used to have trouble remembering to clean my kids' teeth. I ended up having to bring them to a dentist just so that the dentist could remind me to clean their teeth in their dental office. I'm learning all my secrets today. During the dental appointment afterwards, don't be afraid to ask questions. No question is a dumb question, especially when it comes to the health of your children. So go ahead and ask those questions, and praise your child for a job well done, so that they feel a sense of accomplishment, right? And so all of that will help to give them a positive outlook on seeing the dentist, which will then hopefully carry on into their adult life when they have to make sure they're taking care of their teeth on their own. So if anything, I hope all of you are taking away today that early dental care can lead to healthier, happier life for your children, but also for yourselves, people of all ages. And I really thank you so much for your time today. I appreciate your attention and your interest in this. And if you have any questions, please let me know. Thank you.
Well, thank you, Bonnie. That was really wonderful. And we've also got some really wonderful questions. So let's just dive in, okay?
Oh.
Listening to you, I'm glad that my 18-month-old granddaughter just went to the dentist for the first time. So thumbs up for that. I can relate to the first question. The parent here or grandparent is asking, looking for ways to encourage and instruct young toddlers to brush their teeth.
Yes, that's always the struggle, right? Well, besides starting when they're an infant, so that they get used to it, but I'm a big fan of incentives and rewards, and but to try not to make it like a candy reward. So I know M&Ms used to be very popular with potty training because they're portable and they're bite-sized, but maybe moving away from something like that and saying, oh, we can, read an extra story tonight after we finish brushing our teeth. Getting them engaged with it by having different toothbrushes. Maybe they can select the type of toothbrush that they can use, because then they feel a little bit more in control of the situation, and almost feel like, oh, this is fun. This is like picking out, my new school supplies for the year. I know that's an older age, but sometimes when children are able to select something, they feel more engaged or more willing to let you do that, because it involves like a toy or an object. Mhm.
Yeah, absolutely. Okay, good suggestions. Thank you. And Dr. Ju, you mentioned that you like to see babies come into the office as early as 1 or when they get their first tooth. But how long should parents really be brushing teeth for or with their children?
Yes, great. Well, I'd mentioned, 2 minutes, but of course, if your child has only two teeth, you don't necessarily need to do 2 minutes. I'd say 2 minutes for a full mouth of teeth. Kids get about 20 teeth, so there's enough teeth in there. When they have a couple of teeth there, you can try using the toothbrush, a very soft one. They have ones for infants and toddlers. You can even just use a thin washcloth. So I like those baby washcloths, because a face towel for us tends to be thick, and it gets a little bit cumbersome, clumsy to put in the child's mouth. But those nice baby washcloths are really good, and you can wipe the teeth, wipe the gums, and it however long that takes you, maybe about 30 seconds. And you can also gauge, because at that young age, if they're fighting you, you want to put in definitely a few seconds, but you don't want to make it a power struggle at that early age. It's more of a collaborative effort. Mhm.
And when kids start to want to do it themselves,
Mhm.
what do parents do then? You mentioned wanting parents to help until the kids are about 8. How does that kind of go? Do you let them brush and then you get in there and finish up, or what do you suggest?
No, exactly. Something that kids do well with are timers. So there's those old-fashioned sand timers. Some parents like to set the alarm on the phone, or play a 2-minute video on their phone. There's a nice Elmo toothbrushing video that's online. YouTube has some great ones. Anything that's about 2 minutes, then that way they're actually brushing while they're watching the video or singing the song. So you don't even need a screen. You can just sing a song together. You as a parent can sing while they're brushing, so that they're distracted. And before you know it, it's like when we do anything with music, right? Time flies by. So that's something that can help. But definitely I recommend them brushing first, so that they can get used to, being in charge of brushing their teeth, and then you can go in after. If your child doesn't want to brush at all and they're fine with you brushing their whole mouth, that's okay with me too. I don't know any 20-year-old who doesn't know how to brush his or her own teeth. So, it's more about getting those teeth brushed at a certain point.
I mean, I admit to getting very motivated by my electric toothbrush has one of those little timers with the happy face.
Yes.
I It gets me every time. It's just fun.
Yeah, exactly. A lot of the electric toothbrushes now will ding or chime when you get to after every 20 seconds to tell you to move on to the next section. So you can do the same with your children. It's like every 20 seconds, have some type of notification, whether it's again a new song, or some type of chime on your phone, or a timer.
I
Mhm.
like that Elmo video idea too, that maybe you just get that video when you're brushing your teeth, right?
Right, exactly. They actually have that type of version, not the Elmo one, but I've heard of different ones in different languages. So every culture seems to have that video to help them get through that brushing time.
That's great. That's great. Um, so here's a good question. Is a water floss or hydro floss good for kids?
Great question. So it's not necessary because it can be very messy, but some kids, if they like it and it empowers them to want to take care of their teeth, then I'm okay with it. They With the water flosser, it does not take the place of flossing though, in that it's a very strong jet of water and can loosen food material, but that sticky plaque that is hiding in between the teeth really works best in it's the best type of removal is using the floss to to scrape it out, so to speak. So I wouldn't use the water flosser in place of flossing your child's teeth. But if they enjoy it and it motivates them to get through the brushing and flossing process, then that's okay. It'll probably get all over the it's pretty it can get kind of messy though. Sometimes, parents will brush their children's teeth in the bathtub or shower. I mean, it's great and that, there's all the water there, but there's really no place to spit. And I wouldn't studies have shown that there can be bacteria in your shower head too, though. So this is actually probably more for adults that like to brush their teeth in the shower. Um, I'm not an expert on that, um, but I have read some studies that there can be bacteria in shower heads. So you might want to think twice before brushing your teeth in the shower. Um,
Okay. Okay. Fair enough. Here's another good question. My 7-year-old son is a mouth breather. The dentist recommends an expander. Are there many disadvantages for mouth breathing?
Mm-hmm. So, great question. The mouth, when you're breathing through your mouth, that means that your mouth is drying out more quickly than if you were breathing through your nose, because more likely that your mouth is closed, right? So when our mouths are closed, they're more hydrated. The saliva flow from our salivary ducts is keeping our mouth hydrated. When it's open, all that air is hitting it. And some people can't avoid it. My son had to breathe through his mouth because he had respiratory issues and really bad allergies, and he could hardly breathe through his nose. So he had to breathe through his mouth. The expander sounds more like having to do with the shape of your son's jaw and might be more part of the orthodontic treatment, and may help with the mouth breathing. But with that's it's great that your dentist is addressing that issue though, because some may think, oh, that's something they'll outgrow or something, but it can be a symptom of lots of different things. And so the best thing to do would be, if you notice that in your child, to ask the dentist what the best approach is. But yes, so, and remember, dry mouth can lead to more cavities, so that's the whole reason to address breathing through your mouth if possible. If in the meantime, while you're working on that, then you definitely want to make sure your son is getting his teeth is that your son's teeth is getting brushed really thoroughly, whether it's by him or by you, or by him and then you checking it, and then helping to brush again, or using disclosing tablets or solution. Those are the ones that maybe we grew up with, where you chew the red tablets and spit it out, and then whatever's, if you have plaque still on your teeth, it'll show up red and you have to go back and brush it off. Indicators like that can help, but definitely you can get more cavities if your mouth is drier.
Okay, okay. I like this question too. What are the reasons why people use non-fluoride toothpaste? Are there alternatives to fluoride?
Yes, yes, good question. So there are a lot of people that are very mindful about what they introduce into their bodies and their mouths. And the mouth is a portal to, your whole body. So I totally understand. And I my presentations are best based on evidence-based publications and scientific studies. And so as a dentist, I'm focusing on teeth. And what I know that helps teeth is fluoride. Fluoride helps to remineralize teeth, and prevents cavities. many people who maybe like alternatives or maybe not so crazy about the fluoride, that's okay. There are some other types of dentrifices that are not as readily available, but they are out there. And it's a good question to ask your dentist because you want to find out what your risk level of getting cavities is. Mine is pretty high. So I actually use a toothpaste that's prescription strength fluoride because I get cavities even as an adult um, relatively more regularly than somebody else. So that extra fluoride helps me. Other families who want alternatives, there are some maybe calcium phosphate, there's things called MI paste that are used in dental offices, but it can be used on a daily basis, but again, it's more prescription level. So those are the things that you would want to talk to your dentist about. There are natural toothpaste out there that don't have fluoride at the supermarket over the counter, and there's nothing necessarily wrong with them, but they just don't contain that evidence-based cavity fighting ingredient fluoride in them. But that's a really good question to ask your dentist so that they can customize your home care for your teeth.
Right. So now I grew up in Palo Alto and I remember when they started adding fluoride to the water and we were glad. But do most cities do that now?
Yes, many cities, if not most, yes, almost all, now have fluoridated water. When I was a dentist, when I was doing my first research project at UC 20 years ago, I remember trying to track which regions had water, and not all of them did, especially San Mateo County, because many regions are supplied with well water, and that still be the case in some areas. But the studies have shown that once they fluoridated the water, and it's very small, it's like gosh, I think it's like 1 part per million. Toothpaste has about 1,000 parts per million toothpaste fluoride, and prescription toothpaste has 5,000 parts per million fluoride. So that kind of gives you a kind of a gauge. That one is very small, but that minuscule amount of fluoride actually made a big difference in the dental decay rate in the general population.
It did. It does not sound like you won the teeth lottery, Dr. Jew.
No, I've gum disease runs in my family, so but that's probably why I'm so familiar with all the dental types of problems. Yeah.
Good thing though. So what do you do or what do you suggest if you have a child who is really fearful about going to the dentist? Say they're 5 and they've never been and they're just scared. What should a parent do? You've given us some ideas, but are there books or TV shows or things they should look for?
Right. Yes, definitely. Actually, that's one slide that I had skipped was reading books about, there are a lot of books, great books about the first visit to the dentist, preparing ahead of time, letting them know, okay, they're going to be asking you to do this, open your mouth wide like a lion, and they're going to count your teeth, and they're going to tap on your teeth. You can also, schedule an appointment, check in with your dental office to express to them that your child is very nervous and has never seen one. And perhaps maybe that first appointment, all they get done is walking through the office, sitting in the chair, and being introduced to the saliva ejector that has a suctioning sound, because that can be a little bit frightening for somebody when they've never heard it before. Spraying water, I squirt water all over the place with my, water that looks like an elephant nose. So I try to use children-friendly terms too, along with the real term, because kids are very smart these days. I keep saying that because I didn't know anything when I was little, but the kids that I work with now are very intelligent, but to make it relatable to them. And so we try to desensitize them to going to the dentist. And again, that might mean that the first appointment is just stepping into the office and being introduced to different things. Maybe ask your dentist if they're able to go into the dental office before the dental appointment so that they have an idea of, what to expect. Stickers never hurt either. I'm not telling people to bribe your children, but there's a fine line, but to try to make it a positive experience where they, and to reward them for their bravery and their effort too. So that's something that can help. So associating more positive things than the negative, and being careful not to instill our own fear into our children by saying, okay, now don't be afraid, it might hurt a little bit, but you'll be okay. Those are all very innocent terms. And as parents, we're always trying to prepare our children, right? But that alone can make children nervous before they even get to the dental office.
That makes sense. We know that kids do better when they have a little bit of advance warning, like taking them to school before they start. So that's a great idea. And I think parents may not know that they could ask the dental office that.
Right, right. And don't get mad at me though when you bring your 2 or 3-year-old in, the first time, and then to introduce them, and then when you bring them in for the real appointment the second time, they scream bloody murder and don't even want to walk through the front door because even with a lot of preparation, kids are, just going to have their own idea of what they want to engage in and what they don't. So that's the other thing I've seen. Sometimes it's nice that I get a lot of things done on their first appointment because they're not quite sure what to expect. And they kind of went with the flow. But then I see them for the second time, even though it's nothing, nothing major, nothing painful. But I think just being in that environment, they don't want to be there again. So I know parents know their children the best, right? So you know what type of personality your child has, and that can apply to the dental, introducing the dentist too.
If you have a child who tends toward being anxious, would that be a good reason to try to find a pediatric dentist?
Oh, great question. Yes, so general dentists can see people of all ages, and many are terrific with children. Some prefer to refer out to a pediatric specialist. So your dentist may even recommend to you, oh, go see this great pediatric specialist I know. The main difference is that that I've seen is that, well, in a pediatric specialist office, it's geared towards kids, right? So the dental environment might be a little bit more accommodating for children, especially young children. And the thing I always hear from parents is like, oh, they have great TVs, they have video games and things like that. And again, it's a positive experience. It doesn't mean that the general dental office that doesn't have it isn't going to be as good, because maybe in that office, the child has accompanied the parent to their dental appointments and see that their parent looks at ease, has a great rapport with the dentist. So now when it's time for the child's turn, they're all ready. I've experienced that a lot in my own family practice, is that the kids actually want to sit in the chair like mom or dad, because how come mom and dad always get to go, get to sit in that chair and I have to sit on the side? I want to sit in that chair, so that can be a benefit of seeing your own general dentist or having to see your own dentist. But if they already show anxiety, perhaps the pediatric dental office can be advantageous. I'd say the main reason distinction with the pediatric dental office too is that if your child is very young and needs a lot of dental work, the specialists have training to do that as efficiently as possible.
Okay.
So yeah, if your child just needs a checkup and a cleaning, maybe a couple of fillings, then it might be more convenient for you to bring them to your own dentist, or like I said, they might already be comfortable there. Then by all means, continue and that dentist feels comfortable doing that. But the specialists are wonderful alternative, and even to grow up in that environment as well. So just kind of gauge.
All right. Well, thank you, Dr. Bonnie Ju. This has been such a pleasure. We thank everybody who is with us today, and we just know that you've helped a lot of people through your work, Bonnie. And do you want to have any final words about Sonrisas, just so people know what that is?
Oh, thank you. Yes, well, Sonrisas is a wonderful place. I love working there. We're a nonprofit dental office, very similar to Thanks for the Hearts, to a regular private office, but we're a little bit bigger, and we actually have a mission to try to increase access for parents and people and families who have limited access to dental care. So 75% of our patients are considered low income or have trouble finding a dental office. And we have an office in Half Moon Bay and San Mateo, and gotten to the point where we are at capacity and often have temporary holds on seeing new patients. But for people who might have trouble finding a dentist, or who might have Medi-Cal and have an urgent dental needs, or their children might, then we try to do our best to try to accommodate them or refer them to places that might be able to see them as well. But my job as the community engagement director is to go out in the community and basically help people increase awareness to the importance of maintaining your oral health and getting you excited about taking care of your teeth and that of your kids, and helping you connect with dental care if you need it.
That's a wonderful mission, Bonnie. Thank you. And I want to let you parents know that we did this presentation with Sonrisas also in Spanish. So on our video library, you'll be able to find both Dr. Ju and Brenda Barrientos, who's a dental hygienist, who did the same lovely presentation in Spanish. So thank you so much, Bonnie, for being with us tonight. And thank you, everybody, for joining. Take care, everybody. Good night. And I hope to see you all again soon.